Hello, Dr. Cisse covering anatomy and physiology. Today we'll talk about anatomical reference terminologies. So those are reference terminology we use to compare different parts of the body. We're going to start with the anterior and posterior. Anterior means the front side, posterior means the back side. For example, the nose is anterior to the ear. The ear is posterior to the nose, front and back. Then we have ventral and dorsal. Now, for us as human, we're standing, the anterior, posterior, and ventral, which means the front, and dorsal, which means the back, will mean the same thing. But if it's like a four-legged animal when they're kind of not on standing like this, but four-legged, then the ventral will be the bottom part of them, and the dorsal will be the top. But still, the anterior will be the front, and the posterior will be the back. It'll be a different term. What about distal and proximal? Distal and proximal is just when you're comparing two parts on the same limb. Let's say we are comparing the arm on 2 points on the arm and 2 points on the leg. For example, if I take my hand, I will say my wrist is distal to my elbow, and my elbow is proximal to my wrist. It means my elbow is closer to my trunk compared to my wrist. So distal and proximal will be 2 points on the same limb. My fingers are distal to my shoulder. My shoulder is proximal to my fingers. Lateral and medial means lateral to the side, medial to the middle. For example, your heart is medial to your lungs, and your lungs are lateral to your heart. Inferior and superior, top and bottom. The head is superior to the stomach, and the stomach is inferior to the head. It just means bottom, top, and bottom part. What about internal and external? Internal means inside, external means outside. For example, if I take the inside of the heart, it is internal to the outside of the heart, and the outside of the heart is external to the inside of the heart. Frontal and occipital. Frontal means something to the front, like forehead, and occipital means the back of the head. For example, the back of the head is occipital and the front is frontal. If I have 2 points on top of the head, I will say this part on the frontal is frontal and this part is occipital. What about rostral and caudal? That's going to be for four-legged animal. If I have an animal 4 legs standing like this, the rostral will be the nose and the mouth part, and the caudal will be the tail part. Rostral, head, caudal, tail part. Then we have superficial and deep. Superficial means on top, and deep means inside. Now, when you think about it, external, internal could be interior, inside something and outside something, but the superficial and deep could be the same organ but going through it. For example, the top of the skin here is superficial to the muscle is superficial to the bone, and the bone is deep to the muscle. The central and peripheral. Central means something in the center, peripheral means to the side. For example, the peripheral nervous system will be all the nerves coming out of the body. The central nervous system will be the brain and the spinal cord in the middle. The ipsilateral and contralateral. Ipsi means the same side, contra means opposite side. The right ear is ipsilateral to the right eye. If you cut the body medially in the middle. But the right ear is contralateral to the left ear. It means if I cut the body in half, they'll be on 2 different sides. Plantar and palmar means what? The palmar means the palm of the hand, and the plantar will be the sole of the feet. Thank you very much.